Okay, Tanya. So we're going to hop into the assessment portion of this session. And I have a couple questions I want to ask you. Um, they're part of a mental status exam, which just is making sure that you're aware of where you are right now and stuff like that. Is that okay?
Yeah, it's okay.
Okay, so the first question I'm going to ask is, do you know what day it is today?
Yeah, today's Saturday.
Okay. And do you know approximately what time it is?
Mm, I got here my appointment was at 12. We talked for, I don't know, it seemed like 20 minutes. I didn't check my phone when I was in the bathroom, but I guess like, I don't know, like 12:30, 35 around that.
Okay. Do you know what year it is?
2021
Yes. And then do you know where you are sitting right now?
in an office.
Yes, awesome. Okay. Now that we're done with that, I just want to jump into kind of the presenting problem and the goals of our treatment. And so the first question I want to ask you is what are your problems and concerns just regarding
Um,
yourself and for treatment?
I guess just pretty much like my goals kind of to like, I don't know, kind of find who I am.
Okay.
Um, yeah.
All right. And um, with that, finding who you are, is that in regards to just yourself or who you are with others?
I guess like for myself, because like I feel like I try to tailor my personality to others, and I don't think that's the right mindset or kind of way I want to live my life. I kind of just want to be myself and have people be okay with that.
Yeah. Can you give me an example of how you tailor yourself to others?
Like I would discuss a little bit earlier, like I said, like I kind of change my friend groups quite often. Like I'll just like cut them out completely, but usually what they like is usually what I'll change my interest to. Like for when I was in school, um, I made some friends through there, and they're really into like going out and going to bars and stuff like that. And so like I kind of changed my personality to kind of fit that. I was made it seem like I was okay with going to like, the club and like bars and stuff like that. But after like a while, I was just like over it. And then like I had other friends. Like I met another set of friends that was they were like really sporty, I guess. Like they like to go on runs and stuff. And then so like I kind of got in that mindset, but then I was just like, why do people run for fun? Like it's just torture. So like I cut them out. So like I feel like I'm not really friends with people that with stuff that like I like personally.
Okay. And what do you think the impact of this struggle you're having with your identity? How is it affecting like your stress level or your day-to-day life?
Mm, I feel like stress levels usually pretty up there. Like yeah, I think it's up there. I feel like I think about it a lot and it takes up like a lot of the day
Mhm.
on like during times when I should be focusing like on work and stuff like that.
Okay. And does it have any effects on your sleep or your eating?
Mm, I mean, I guess it might. Oh, I usually always had trouble sleeping. It's just always been a thing for me since I was little.
Okay.
And then for eating, um, okay, maybe not that, more sleeping because like I normally just eat like once a day, but that's been like my norm for a while.
And is this your first attempt at, you know, trying to explore this problem, or have you gone through other treatments before? Because I remember
Um,
you mentioned you had some therapists in the past.
Yeah, I've had some therapists in the past, but that was mostly for I've when I was around like 13, I used to like self-harm myself a lot by like cutting my arms, cutting my legs, and then so I got put to see a therapist around that time, and then I just always kind of would see them frequently throughout my life. So like that was like 13. So like I'm 26 now, so yeah, pretty much like half my life I've been seeing therapists. But it was mostly on just kind of, I guess, treating that issue, not more of like what I'm currently experiencing.
Do you still self-harm?
Not not to the extent that I used to. I mostly just like I would say like I've been pretty good on not doing it, but like I did have like a suicide attempt on when I was like around 18,
Mhm.
and then just like recently, I would say like 3 months ago, I tried to OD on some medication.
Okay.
But like besides those two times, I haven't like self-harmed or like cut my arms or anything like that.
Okay. And currently, right now, are you having thoughts of hurting yourself?
Not at the moment. um, the last therapist kind of I went over with like the last attempt 3 months ago, before like my insurance changed, and then I guess that's why I'm in this office now.
Mhm.
But like we kind of like discussed it and went over it, but now it's more of just the other things I mentioned right now.
Okay, thanks for sharing that with me. That is a very important piece of information. And I just want to make sure that every session we check back in on that, see where you are. And if you're open to it after the assessment, would you like to go over a safety plan with me?
Yeah, that's fine.
Okay. Um, so you mentioned you're in the like 3 months ago, you had a suicide attempt. Were you hospitalized for that?
Yes.
Okay. And how long were you in the hospital and where?
Um, it was somewhere in San Diego. I would say it's probably just a couple of days. I don't really, I would like, because I was kind of out of it, so like
Mhm.
probably like the first like 24 hours were kind of hazy. So I would just say like a few days.
And what kind of medications were you trying to OD on?
Mm, it was just like my like like um what was it? I had Xanax, so I guess I was taking those.
And are you prescribed Xanax?
Yes.
Okay, are there any other medications you're prescribed to?
No, just currently that one.
Just Xanax?
Yeah.
Okay, and then who gave you that prescription?
My previous therapist.
Okay. Um, I also know you mentioned that you would go to bars with your friends a lot. Have
Mhm.
you had any history of substance abuse? And are you
Like
currently using any substances?
would drinking alcohol count as a substance or
Yeah, like drinking alcohol, smoking weed, taking pills, or any sort of street drugs.
uh no street drugs. I do drink on occasion, but like it's not like it's more wine than beer. I don't really like beer. That's gross to me. Um I like just having like a glass of wine every night.
Every night.
Um does the tobacco count?
Does tobacco? Yes, tobacco counts.
Um I, it's like maybe like one cigarette a day, maybe two sometimes.
Okay.
Um I don't really like weed. Um so I guess that's it.
And then how about any street drugs like ecstasy, heroin, meth,
Oh no.
no PCP?
Mm,
And then you said you have a prescription for Xanax. How often are you taking Xanax?
mm, I think it's daily.
And how many a day?
It's just one.
Just one? Okay. And do you have any history in your family of substance use?
Not like that I could think of. Um, Not in my household, but probably
Mhm.
like my parents and uh, like siblings. But I don't know if like anyone else in my like aunts and uncles. I don't know if they did.
Mhm. Has anyone ever told you that they're concerned about your substance use?
Mm, Mainly when I was with that group of friends, I guess my mom would just um, call me and just be like, "Tony, you're not like this is taking away from like your school. Like you, I can tell just by your sisters are saying that like your grades are slipping and you feel like you might go on academic probation." So like I guess just my mom when I was like in that group of friends going out.
Okay, so you mentioned your grades slipping and the academic probation. You would say that was because of your substance use?
Yeah, because prior to that, I think I was doing pretty well. Like I was getting like A's and like high B's. Like I've never been like a straight A student, but like
Mhm.
I felt like when I made the change to college, I was able to kind of be doing like relatively well. But like once, like I said, like with those people, like it just started dropping, and I felt like I was kind of struggling
Mhm.
because like sometimes I wouldn't even go to class. I'd just be hungover,
Okay,
and I just didn't want to like drive down there or walk over.
yeah. Have you ever been into any drug or alcohol treatment centers?
No, never.
No. Okay. Um, and switching gears a bit, we're gonna start talking about trauma, and I just want to let you know if there's any questions that make you uncomfortable or you don't want to answer, you can always say pass. All right,
Okay, thank you.
of course. So starting off, have you ever experienced a traumatic situation? And do you know what that means, a traumatic situation?
No, no. Can you clarify that for me?
Yeah, of course. So a trauma is classified as essentially a life or death situation that you either experienced firsthand and saw, or someone close to you experienced. One second. So, for example, that could be like something deeply distressing, such as a death of a child or a loved one, or even like a physical injury, or a sexual trauma like being raped or molested when you were a child. Have you ever experienced any of those?
Well, like around like when I was like in middle school, probably like I don't remember how old you are when you're in sixth grade, but like my first grandparent died. Um, so I feel like that was pretty like traumatizing for someone who's never experienced like death before.
Yeah.
And then when I was 18, at my first like college party or whatever, I never been to any one of those. Like that night was kind of hazy, and like I feel that like I might have been raped by someone, but like I'm honestly not too sure because of just like how that night went.
Mhm. Well, thank you for sharing that with me. I know recalling those types of memories, whether or not they're hazy, is can be a bit uncomfortable. So, were you under the influence the night that happened?
No, yes.
Yes. Okay. So that's something we'll touch on later in treatment. Um, but I want to let you know that, I appreciate you sharing that with me. It's important information. Um, as for medical history, do you have any chronic illness or physical injuries that have happened recently?
Mm-mm.
No. And then Have you ever had any medical problems or general health conditions?
Mm-mm.
Okay. And medications, you said you're just prescribed Xanax, correct?
Yeah.
Let's see, and do you currently have insurance?
Yeah, I'm using Medi-Cal right now.
Okay, and do you have a primary care provider?
Yes.
Yes, okay. I would suggest before our next session, making an appointment with your primary care provider, just to do a physical and some blood tests, because sometimes biological symptoms can present as either depression or other sort of psychological stuff. So I just want to check all our bases and make sure that your body is all good. How does that sound?
Uh, that sounds good. I just would need to like request time off from work to do stuff like that.
Hmm,
But it seems doable, I guess.
okay. Yes, just let me know if you're facing any barriers to that. Keep me updated.
Okay.
Okay. Let's see. And have you ever used any alternative or non-traditional medical treatments?
Like, what do you mean?
I guess an example could be using medical marijuana for anxiety, or I don't know, some cultures they use like a medicine man for like migraines and herbal supplements and stuff like that.
Mhm. No, I don't think so.
No?
Mm.
Okay.